Assalamualaikum warahmatullahi wabarakatuh. Thank you to the committee and the panelists for the opportunity. My name is CHALID KURNIAWAN. Today, I'd like to present my research about bevacizumab versus ranibizumab in macular edema due to retinal vein occlusion short-term outcome. As the introduction, retinal vein occlusion is the second most prevalent of retinal vascular disease after diabetic retinopathy, and the RVO is more prevalent than the CRVO. The development of macular edema is the main cause of visual impairment. The increasing of vascular endothelial growth factor leads to the increasing of permeability of vascular and also leads to the edema. Study has reported that anti-VEGF injection has the functional and anatomical improvement for the patient with RVO. And the main purpose of the anti-VEGF injection is to decreasing the level of VEGF and leads to the decreasing of edema. Whereas other study comparing bevacizumab and ranibizumab in the long term, we'd like to show the study for the short-term outcome in just after 3 months after the injection. This was the retrospective study for the patient with macular edema due to retinal vein occlusion, which is treated by IVB or IVR. These were the inclusion criteria and exclusion criteria, and all of the patient has a complete ocular examination and also SDOCT. There are two study outcomes. The primary outcome were the change in CMT and the change in visual acuity after 3 months. The secondary outcomes were the difference of number mean injection and difference of mean change IOP after 3 months. For the demographic and characteristics data, we found that there are no statistical significant difference between the two groups in age, gender, duration of symptom, diabetic, hypertension, hypercholesteremia, smoking, and lens. And also, there are no statistical significant difference in baseline of visual acuity, central macular thickness, and IOP. In clinical outcome, even though they are increasing in visual acuity and also decreasing in central macular thickness after 3 months, but there are no statistical significant difference between the two groups. And that's also found in the change in IOP. This is the graph for the change in visual acuity and CMT for the two groups. As discussion, retinal vein occlusion is more prevalent in patient with age more than 65 years old, but in our study, a younger patient has prevailed. In the Beijing eye study, they found that patients under 45 years old could also have RVO, and the RVO is more common in males, and the RVO is 4 until 6 times more common than CRVO, and both of these happens in our study. There are some risk factors for RVO, and we conclude that in our study, there are hypertension and hypercholesteremia that the main risk factor for the RVO, and most of the patients are the smoker. In our study, we can find that IVB has the same result with the IV in the case of visual acuity and the CMT, compared with the other study, such as the RVO study, MARVEL study, and CRAVE study. They found that IVB is non-inferior or have the similar effect with the IVR. We know that the increasing of ocular volume and also the drug properties of anti-VEGF could lead to the increasing of IOP, which is can acute or sustained. In our study, they are increasing in IOP, but there are no statistical significant difference between the two groups. In the mean number of injections in just 3 months, we got 2 average IVB or IVR were given compared with 3 other study, BRAVO study, CRUISE study, and real-world study. We have a decrease in CMT and also increasing in visual acuity, but in the lower value compared with the other study. This all makes sense because in our study, the cut point is only in 3 months. The major limitation of study is small sample size. And as the conclusion, in the short term, both IVB and IVR have relatively similar outcomes in increasing visual acuity and decreasing central macular thickness for the patient with macular edema due to RVO. That's for my presentations. Thank you very much. Welcoming for your questions. Assalamualaikum warahmatullahi wabarakatuh.